This is a podcast of the Nuffield Department of Medicine. Today we talk to Dr. Paul Turner about microbiology in the tropics. Hi, Paul.
Hi.
So you are the director of the Cambodia Oxford Medical Research Unit. Can you tell us a little bit about what the unit does?
Sure. So the Cambodia Oxford Medical Research Unit, or COMRU, is one of the youngest members of the Oxford Tropical Network. We're based within a children's hospital, the Angkor Hospital for Children in Siem Reap, Cambodia. And we run a program of research which is directly relevant to the diseases that we see in children presenting to the hospital. So diseases that are particularly important in Cambodia, mostly infectious diseases. Pneumonia is the commonest cause of admission to the hospital. We also see a lot of typhus, typhoid, and other infectious diseases that are common throughout the tropics.
Can you tell us a bit about your own personal research interests?
Yes, my major research over the years has been childhood pneumonia, and in particular one bacterium which is a common cause of the most severe presentations of pneumonia, Streptococcus pneumoniae. So I'm particularly interested in how that bacterium goes from asymptomatically colonizing the back of a child's nose to then going on to causing disease, in particular pneumonia, but also meningitis and sepsis.
And you're a microbiologist. What are some of the biggest challenges working as a microbiologist in a place like Cambodia?
Yeah, so Cambodia is struggling still to recover from its recent history, in particular the Khmer Rouge genocide and the subsequent civil war. This has left us a country with very limited infrastructure, and we have to overcome problems related to that on a daily basis. Particular issues that we struggle with are erratic electricity. So we have wonderful equipment, but we often suffer early failures because of poor voltage stabilization and things like that. We also struggle to maintain our supply chain, so all of our reagents and consumables are imported, and it can often be frustratingly slow to receive essential supplies.
What are the most important lines of research that have emerged in the last, say, 5 to 10 years?
Well, there's been a massive leap forward in terms of pneumococcal disease and pneumonia that occurred as a result of the introduction of the pneumococcal conjugate vaccine. So this is a vaccine or a series of vaccines that stimulate the immune system in children and protect against up to 13 of the more than 90 types of this one bacteria that I'm interested in. So this has changed things enormously in that now we can prevent a large proportion of these infections. However, what we don't know so well is how well this vaccine will work in less developed settings. So the trials were mostly in high-income countries and not in countries where there's a significant burden of antimicrobial resistance, for example. So we're working now to kind of map the introduction of the vaccine in Cambodia and see if those impacts that we saw in the trials are seen in kind of field conditions in Southeast Asia.
Why does your line of research matter? Why should we put money into it?
I think the important thing about our research is it's very practical. It's very based on diseases and infections that actually affect the population that we work in. We know that Southeast Asia is a very heterogeneous region, so there are relatively affluent areas, but also often forgotten areas of poverty, such as Cambodia, Myanmar, and Laos. And our projects are rooted in those countries and really working towards improving the health of the population of rural Southeast Asia, and where applicable, use that knowledge to improve the situation in other areas. So we always try and make sure that the work that we do is based on a clinical need.
So how then does your research fit into translational medicine within the department?
So we try to always, with our research projects, answer a practical question, one that is of immediate or almost immediate benefit to the population. So an example of that is evaluating with colleagues in Laos a new diagnostic test for typhoid. So this would lead to a quicker diagnosis in a patient and we hope a better outcome. Where other examples are kind of trying to understand the burden of infections that are acquired within the hospital to come up with interventions that will work in settings such as ours. So we're not really interested in abstract questions. We want to make a difference to our patient population.
Thank you so much, Paul. That was really interesting. Thank you.
Thank you.